And welcome back. This month is Cataract Awareness Month, and more than 25 million Americans are estimated to have cataracts. Now, as the population in America continues to age, the number of cataract cases is projected to increase into 38.5 million by the year 2032. Keep us more in depth with a discussion and giving us more information. We're pleased to have optometrist at Pelham Parkway Vision Center, Dr. Diana Ilyasova. And Dr. Ilyasova, thank you so much for being with us.
Thank you so much for having me on today.
Thank you. Well, having this conversation is important. As we said in the intro, the numbers continue to increase, and some people aren't really so familiar even with cataracts. So let's start out there. For somebody who doesn't know what cataracts are, please give us an insight.
Okay, so cataracts is actually like a normal aging of the eye. Our eye has a crystal lens that's positioned right behind the iris, and this crystal lens is usually clear all our life, hence the word crystal. But after 40s and actually technically after 60s, the protein and the fibers of that lens start to break down, and the patient now experiences a more of a cloudier view because the lens, the crystal lens, becomes more cloudier.
And so when we talk about this lens becoming cloudier, it happens over time. And how often and how common are we finding this to be the case?
So cataract is actually very common, and as you age, it becomes more and more common, especially with our aging population. We're seeing this on a daily basis, and it's fairly common after 70.
I'm sorry, I didn't mean to cut you, but give us some insight as to probably symptoms that somebody should be paying attention to before making that decision to go see a doctor.
Okay, so cataracts start out initially like symptomless. People are not aware of that clouding that happens in their eye. However, with time, they will start noticing fading of colors, blurring, foggy vision, glare at night, becomes very hard to drive at night, intolerance to brightness of light, fading of just brightness and color. It's more like a dimmer vision.
And when we talk about having cataracts, I know I remember my mother in personal experience, and the doctor said that there are different kinds. And so can you walk us through, because I understand there are different types of cataracts that a person can contract?
Yes. Well, let's first separate that we have age-related cataracts, which happens very commonly as a person ages, but there's also congenital cataracts. There are kids who are born with a cataract, and that's usually due to a genetic defect or an intrauterine infection or whatnot. So let's divide that as, something cataract you can be born with. And then there's cataracts that happen with time. Now, the cataracts that happen with time, or actually cataracts they can be born with as well, we divide them, we categorize them by where it is in the crystal. If the fading happens more in the nucleus, in the center of that crystal, we call it the nuclear cataract. And if the fading starts happening on the outside shell of the crystal, we call it the cortical. And if the fading happens on subcapsular level inside the crystal on the back end, we call it the subcapsular cataract, subcortical cataract. Mm-hmm. And these cataracts, especially the nuclear cataract is the most common one, and the subcortical cataract happens mostly with certain medication use. And and every single one of them basically gets taken care of the same way.
And when you talk about taking care of it the same way, obviously talk to me about treatment. What are the treatment options that are available?
So as of now, it's still surgery. And I say now because, technology can always introduce something new and, phenomenal. There is talks about this possible, I don't want to say yet, but a possible eye drop that can kind of slow down this aging process in the eye. However, let's talk about the real way we take out the cataract is going through a surgery. Now, surgery can sound scary, but cataract surgery is actually done very commonly, fast and fairly easy, and it's It's very quick inpatient procedure.
So when one hears of cataracts, I'm sorry, go
Procedure.
ahead.
Outpatient procedure.
Oh, it's an outpatient procedure. Okay. And when one hears of surgery, I think, and contracting cataracts, I think there's immediate thought about possible loss of vision. How often do we see loss of vision associated with cataracts?
Okay. Loss of vision is absolutely possible with cataract to those who refuse to remove the cataract. So the fogginess will continue to a point where it's just very, very hard to see. Okay. So most of the time, we don't let the patient get to that stage. We try to remove the cataract early on so that they can see, so they don't have vision loss, so they can continue seeing until the end of their life.
Yeah. And Dr. Ilyasova, if a person doesn't opt for surgery, because we know that sometimes people have that aversion of surgery, are cataracts treatable without surgery?
Not yet. Not possible. The whole idea of the cataract surgery is to remove this aging lens, the lens that has completely went fuzzy and blurry, to remove this aging lens and replace it with an artificial clear lens. Aside from surgery, I have no idea how else this can be done.
And how often should a person be checked?
Definitely yearly. Once every year, and a healthy adult, absolutely a must. And during our tests, we will dilate you, and then we'll take a look inside. And one of them, glaucoma and other problems, of course.
Yeah. And we talked about, I'm sorry, go ahead.
I'm sorry, if you do smoke or you are diabetic and hypertensive, sometimes it requires you to be seen twice a year.
And for those who are watching right now, I know there's concern because the numbers continue to rise. Are you seeing more and more people with cataracts coming through your door?
Yes, we're seeing daily cataract patients in our door, thank God, to just a large aging population. And it's fairly common. It's one of those things that you can wake me up in the middle of the night and I'll be talking about it. It's just so common. And it's not as scary as it used to be before to hear about cataracts. Cataracts are fairly done, cataract surgeries are fairly done quickly and with ease, and the patient usually sees the next day already. So it is something that we see very common, but nothing to be afraid of.
And do you feel like the word is getting out more because this is Awareness Month, but a lot of people still aren't aware? Is the word getting spread more?
Yes, I believe so. I believe TVs and social media is spreading, what cataract is and what cataract surgery is. And a lot of doctors use social platforms to talk about some eye conditions such as cataracts and glaucoma on a daily basis. So I feel like the community at large is becoming more and more aware of this eye condition.
Yeah. And finally, is there anything else that you want people to know before we wrap up?
I don't know, I'm biased. I think everybody should be checking their eyes. Think they see well, because you just have to, we do other things, not just vision. We dilate, we take a look inside, and sometimes, the best treatment plan is if something is caught earlier. And I think in a case of cataract, that's the case too. When the cataracts are caught are diagnosed in the right time and taken care of in the right time, when they get up to a little, we call it the ripe stage. We get it to a point where it's a ripe stage. That's actually the best time to remove the cataract. That ensures that the surgery will go flawless. Than waiting, rather much later, and then it becomes more complicated to remove the capsule.
Dr. Diana Ilyasova, thank you so much for being with us. It's okay to be biased. I think this is Cataract Awareness Month. We should make people aware, and I think people should know, right? And I think just like we get every other part of our body checked out, it's important to get our eyes checked out. So it's very important.
I'm loving the glasses on you.
Thank you so much. I go see my doctor once a year, trust.
Good for you.
All right. Dr. Diana Ilyasova, our guest here. Now, listen, if you want more information, do us a favor. Visit their website, PelhamParkwayVisionCenter.com. And then also, you can follow them on social media, on Instagram and Facebook, at Pelham Parkway Vision Center. We encourage you, don't go anywhere. Guess what? We got more open coming up. Stay with us. We'll return right after this.